Attention to all, in honor of the ceremony, attendees are reminded to be calm throughout the ceremony. The arrival of the audience are welcomed and you are asked to be patient as our ceremony will begin shortly. Your cooperation is greatly appreciated. Thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and a very good morning. On behalf of all the committee members, we would like to extend a warm welcome to the distinguished guests, ladies and gentlemen, to the Healthy Minds Network 2.0, organized by Fostech Association. We also would like to express our most gratitude to our panels, Prof. Dr. Firdaus, Mukhtar, and Mr. Aiman to be here with us today. For your information, our first panelist for today is Prof. Dr. Firdaus, and she is a clinical psychologist at Hospital Pengajar UPM, while our second panelist is Mr. Aiman or famously known as Aiman Psikologi, and he is a mental health advocate. In the name of the most gracious and merciful Allah, let us seek strength and guidance during this program. We call upon Wan Muhammad Zaim Zikri bin Wan Zainuddin to recite the doa.
Al-Fatiha. Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala ashrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Allahumma innaka ala kulli 'alim, innaka sami'un 'alim, innaka ghafurur rahim, innaka rabbul 'arsyil 'azim, innaka al-barru jawarul karim. Ya Allah, you are the one who has all the praises. You are the one who has rightly received all praises. You are entitled to receive all thanks. You are the owner of all the governments. In your hand are all good things, and all matters are yours. Allahumma ya Karim ya Rahim. Pour out your grace and mercy on our ceremony, Healthy Minds Network 2.0 held today. Visit from beginning to end. Ya Fa'alu lima yurid. We also seek protection from you, from all things that may tarnish the reproach of our council, and from all things that neglect us, from obeying you. To you we leave our affairs. ربنا عليك توكلنا وعليك أنبنا وإليك المصير. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. وصلى الله على سيدنا محمد وعلى آله وصحبه وبارك وسلم والحمد لله رب العالمين.
Amin, amin, ya Rabbal Alamin. We would like to thank Puan Muhammad Zain for the doa. To enliven our ceremony today, we will sing two songs, the national anthem and Putra Gemilang.
Universiti Putra Malaysia, pembina wawasan gemilang. Universiti Putra Malaysia, membantu siswa cemerlang. Semangatmu di sinar zaman, semerbadamu di suara sanjuran. Menyumbang bakti ke anak bangsa, pewaris sejati negara dan cinta.
Before we go any further, I would like to remind all the audience to take a screenshot of this live as a proof of attendance. So, without further delay, I would like to pass the event to our moderator for today, Nurin Sabrina, to start the forum session.
All right, thank you, Ahmad Daniel. So let's move on with the forum session. Assalamualaikum and good morning, IB, to our panelists, Prof. Dr. Firdaus Mukhtar, Mr. Aiman Amri, and members of the audience who are virtually present with us today. I'm Nurin Sabrina, the moderator for today's forum titled Mental Health Issues Among Students. Before we begin with our forum today, allow me to introduce to you our panelists. We have two amazing panelists with us today. First, I'd like to welcome Prof. Dr. Firdaus Mukhtar, who is a qualified clinical psychologist and currently holds a post as the Deputy Dean at the School of Graduate Studies, Universiti Putra, Malaysia. She graduated from the University of Queensland, Brisbane for her PhD, and currently she is the president of the Asian Cognitive Behaviour Therapy Association. She was the first secretary in the Malaysian Society of Clinical Psychology. In 2011 and 2013, she was appointed as WHO CBT consultant, and in 2012, L'Oreal Malaysia awarded her as Young Woman Scientist for her vast contribution in research related to depression, anxiety, and weight management. Since 2000, she has trained both CBT and DBT to many psychiatrists, clinical psychologists, counselors, medical specialists, allied health professionals, undergraduate and postgraduate trainees, and community at large in Malaysia and also other Asian countries and Australia. She has published over 50 scientific articles and CBT books and has been appointed as subject matter expert by many governments and private industrial collaborators. Interestingly, she is a mother of 6 without a maid but still can find balance between her career and family. How are you today, Prof?
Alhamdulillah. Thank you very much, Sabrina.
That's wonderful to hear. Moving on to our next panel, Mr. Aiman Amri, or better known as Aiman Psikologi, is a mental health advocate who actively spreads awareness of mental health among Malaysians. He obtained his bachelor's degree of science in psychology from the University of Nottingham in United Kingdom and is currently pursuing his master's degree of human sciences in psychology, specializing in clinical and counseling in IIUM Gombak. Mr. Aiman actively uses social media to advocate for mental health awareness and has garnered over 250,000 followers. He had conducted talks and trainings with approximately 150 corporate and government institutions and published 3 books to date that tackle different aspects of mental health. His books include Autism, Unik atau Pelik, How Are You, and Pendiam. Other than that, Mr. Aiman has been featured in a number of mainstream media outlets such as Mingguan Wanita, Padanma, Cosmo, Astro Awani, Bernama, TV Al Hijrah, and Malaysia Hari Ini. To date, his most notable media appearance is as the host for a TV show on RTM1 called Psychosis. Are you doing well today, Mr. Aiman?
Alhamdulillah, I'm doing better now.
Wonderful, wonderful. So before we start off our forum session today, I'd like to briefly explain about our forum. As we know, the COVID-19 pandemic has negatively impacted many people's mental health, including university students. We have chosen the topic mental health awareness among students as an effort to curb the growing problem that is mental health. We believe that awareness has to be raised among the general public, especially to the students who are suffering silently, to reassure them that mental health issues are no longer a taboo topic in this era and that there is no shame in seeking professional help. Without further delay, let's get right into our forum session. Okay. I hope both of our panelists are ready today. To my knowledge, there are many types of mental illnesses, which include depression, anxiety, bipolar disorder, schizophrenia, and others. Students, however, frequently express that they're experiencing depression or anxiety. In some cases, they even experience insomnia to these mental illnesses. Prof. Firdaus, would you care to share with us what is exactly mental health and what are the early signs of someone experiencing mental health problems? How does it differ from regular stress or sadness? Prof, if you may.
Thank you for the nice introduction, Ms. Sabrina. Please kindly share my slide for a while.
All right.
Okay. All right. Assalamualaikum and good morning, everyone. First of all, thank you very much for this invitation. And to my panelist partner, consider my cucu, grandchild, brother Aiman Amri. Nice to meet you again, and happy Father's Day. All right, back to the moderator questions. You have 3 questions. First, what is mental health? It's very important to understand. Everyone has mental health. So what's that mean? When we talk about mental health, it is not the same as mental illness. Or when people say mental layu, yeah, it doesn't reflect mental health. Yeah, it doesn't actually reflect mental health. It sounds more on the tips of the iceberg, mental illness. So, in order to understand mental health, or it will be easier to understand mental well-being. Yeah, it actually reflect 3 things, 3 components: bio, psycho, social. What is that? Bio is biological. Yeah, where there is changes in our chemistry, our immune system, our physiological response, and whatnot. Psycho is a psychological aspect. What is our attitude, our expectation towards something, or how we cope on any difficulties or challenges. And the third component of mental health is social. Who are our friends? How our family treat us? And all the related to the external factors. Yeah. So as a student, how do you think about yourself? Are you thinking, I'm a good student? I'm kind of nervous to speak in public, for example. Second, how is your feeling? Can you identify your own feeling? I'm relaxed, I'm angry, I'm frustrated. And the third component is how you act, yeah? How you do something. Do you eat more when you're sad? Do you sleep throughout the day when you're anxious? Yeah. So how stable or how healthy our mental health, our mental well-being has strongly impact on 3 things. That is, the first is how we interact with others. Is it the same? How you talk to your friends and how you talk to your parents, for example. Second, how you handle problem. Say last time we have face-to-face classes, but now how you handle online classes. Is it easy peasy or oh my God, I just hate it? Yeah. And the last one is how you make decision, how you solve a problem. For instance, because we don't like online classes, do you just skip or you still join but off your camera and mute? Or you try your best to attend actively just like physical classes? So mental health means here the absence of illness or disorder. So what is mental illness? Mental illness refers to diagnosable mental disorder in which it has significant changes in our thinking, our emotion, and our behavior. And most important to be considered as a disorder is that distress or problems affecting our function in social activities, affecting our work, affecting our family activities, yeah, or we don't feel like going to classes. So how do we know? Mental disorder or mental illness can only be diagnosed by psychiatrists or clinical psychologists through what? Through clinical interview based on DSM-5. DSM stands for Diagnostic and Statistical Manual of Mental Disorders. In the DSM-5, it has about plus minus 300 diagnoses of mental disorders to be named. Yeah, so if someone feels sad, not necessarily he has depression. And same goes to the nervous, scary, fear doesn't mean someone have anxiety. So people with psychiatric condition can change over time, and their issue can be triggered by events and circumstances regardless. Is it big or small, predicted or unpredicted? So mental illness is nothing to be ashamed because it is a medical condition, just like heart disease or diabetes. Most important to understand is mental health condition are treatable. Just like coronavirus, mental illness does not discriminate. It can affect anyone regardless of your age, of your background, of your sexual orientation, how much is your parents' income, your race and religion, or any other aspect of your identity. So can a child get a mental illness? Yes, mental illness can occur at any age. So it can take many forms. Some are mild and temporary, and some can be severe and permanent, and may need care in hospitals. So second question, what is early signs of mental illness? Major mental illness such as schizophrenia, bipolar disorder, rarely appear out of blue. Most often, family, friends, teachers, or individuals themselves begin to recognize small changes or a feeling that something is not quite right about something. Yeah, maybe it's affecting thinking, the feeling, the behavior before an illness appear on its full blown. Yeah, so the long list of early signs of mental illness I summarize in 3 points. First, excessive, long-lasting, extreme moods. Yeah, it can be paranoia, it can be worry, it can be sadness, anxiety, or irritability. Second is a drop in functioning. You don't feel like going to see your friends. You don't feel like going to classes. Okay, it's affecting your ability at work, at school, or family functioning. The third one is dramatic changes in eating or sleep pattern. Yeah, maybe when you're so sad, you don't feel like eating, you don't feel hungry at all, or you eat a lot. Same goes to sleep. Yeah, sometimes you see you have trouble to sleep for 3 days, or there are times that you feel like you want to sleep throughout the week. Yeah, so often this is not a single change of the symptoms or of the symptoms, okay, but it can be a combination. Okay, the third question just now is how to differentiate the regular sadness or stress with depression. If you are overwhelmed by stress, you're not alone. Yeah, it's a practically a fact of life as a university student, as a college student. 70 to 85% of students say they experience stress on daily basis. Yeah, that is normal. Stress is good if it is motivates you, but it is bad if it is prolonged and overwhelming. So what's the difference to depression? Depression is more serious and long lasting than stress, and it requires different kind of help. 10 to 30% of college students reported that they're feeling so depressed, and at some point they had trouble functioning. And 3 to 10% actually sought treatment for depression. So how do you tell the difference between stress and depression? Both can affect in a similar ways, but there are key differences. Symptoms of depression can be much more intense. They last at least 2 weeks. Depression causes powerful mood changes such as painful sadness, yeah, despair, and you may feel exhausted and unable to act. Yeah, you can't even move. You can't even do things that you like, or even to watch a movie, Netflix, or game that you used to. Yeah, people can have a mental illness, but be mentally well if they have successful coping strategies and support. Equally, people without mental illness can have a very poor well-being if they face challenging circumstances and do not have coping strategies in place. That's all for now. Over to you, Sabrina. Thank you.
All right, thank you, Professor, for that wonderful insight and about differentiating about the effects of, about differentiating stress and depression. Thank you so much. All right, so let's move on. Now that we've been exposed to the early signs of mental health problems, I'm sure some of us might begin to wonder, are there any cures for mental health problems? What is the best way to improve one's mental well-being? I'd like to ask this question to both of our panelists today. Mr. Aiman, would you be kind enough to share your opinion on this matter first?
Okay, thank you. Thank you to our moderator for the very good question. First of all, Assalamualaikum and a very good morning to everyone. I know it's Sunday, it's weekend, and most of us are basically as a student. I believe that the one who's watching it is a student. So thank you for coming to our session even though it's Sunday. Okay, the question is about does mental illness can be treated or not? Okay, first of all, before we proceed with this question, we have to understand that our session today, although that Dr. Firdaus is one of the like what we call apa macam tokoh lah, icon for clinical psychology in Malaysia, and I'm really have an honor to share the stage with her today. Alhamdulillah, after so long apa tengok daripada jauh kan. But I hope that the one who's watching this understand that our session today is focusing on awareness. So this session is not about asking a diagnosis or asking for a treatment solution for you, because the one who knows better about you is the one who are treating you right at the moment. So focusing on the awareness, meaning that at least you understand a little bit about mental health and how does it affect you, how to get good mental health, how to have a mental well-being, and you know how to get professional help. So that's what we call as awareness. So regarding the question related about how to, is it possible for a pupil with mental illness to be treated or to cure by the illness itself? Okay, we have to understand that mental illness is not something that you can put one for all. It's not just mental illness, but in the mental illness itself, there's a various kind of mental illness. We have, if I'm not mistaken, in the SM5, we have around almost 300, 297, or almost 300 different kind of mental illness, which have their own symptom, have their own intervention plan, have their own way of treating it. So we cannot just use can mental illness be treated, because every kind or every type of mental illness have different way of treating, different way of dealing with it. So that's number one. Number two, so can it be treated? So the short answer is depends. Long answer is depends. Sorry. The long answer is depends on the type of the mental illness. For example, like Dr. Firdaus just said just now about sadness. I know that currently in our country we like so-called like the awareness is there, and some people have this kind of trending mentality that they also have to be depressed. I also have depression and so on, but they only feel like a DASS question, which is depression, anxiety, stress scale of questionnaire, where you answer 21 questions and they will give you like a screening test for your mental health in terms of depression, anxiety and stress. But that's only for screening. There's not a diagnosis. When you seek professional help, either through psychiatrist or clinical psychologist, you undergo through various kind of assessment, various kind of processing of interview, some scale there, depends on your condition, and the diagnosis will be there if you have the disorder. However, diagnosis is not the end of not the end of the journey. It is start of a new journey, because diagnosis not supposed to be a label. It's not that you have a major depressive disorder, for example. Okay, so what now? So we're not just giving you the label, but during the assessment, when you have the diagnosis, you are diagnosed with certain disorder, then there will be a process when you're gonna focusing on your treatment plan. So during this treatment plans is answering your question, does mental illness can be treated or not? Depends on your condition, can it be treated or not? Depends on condition. And second, also depends on you, because everyone have their own different way of being diagnosed of that problem. For example, let's say there are two person here. This is like person A and person B. Both of them are diagnosed with major depressive disorder. For example, major depressive disorder, person A and person B. But person A might have different history, different stressor, different trigger, different social environment, different supportive system, and different way of having the symptom. But then diagnosis is the same, and the second person also have a different way of having all of that. So we cannot just say that okay, A and B both have major depressive disorder, so both can be treated using the same plan. So it's different, because mental disorder itself is a very complicated issue, and I believe Dr. Firdaus have been interacted and exposed to this field more than me, and I think we both can agree that it's a very complicated things to. It's not simply that okay, you meet the client, you look at them, okay, I think you have depression, major depressive disorder. It's not as easy as that. Imagine that you are having a cough. I'm giving you a simple analogy for you to understand. Imagine you having a cough, and when you go to the doctor, does the doctor check your throat? Maybe, you're coughing Oh, how many days have you coughing? Oh, I think you have stage 3 cancer of the throat. So it's not as simple as that. You have to go under throat, you have to check, you have to roll out everything. Okay, maybe it's not your throat, maybe you just need water. Then during the, okay, maybe your throat has problem. Okay, let's check during, let's say, like a bronchoscopy scan. And then they found something in your throat. Okay, then they put out the sample and send the sample to the lab, to the pathology lab. Then the lab will discuss, okay, this is a cell cancer. Okay, baru tahu cancer. Okay, what stage? So you have to do like a PET scan where they will scan you under like a imaging scan. Then they will see, oh, this is like stage 3 or stage 2B and so on. Then you're diagnosed with throat cancer stage 3. So it's the same. How can it be cured? It depends on the condition and your history itself, because mental disorder itself is a very complicated issue, and when it can be diagnosed is when it's complicated to be diagnosed, the treatment also complicated, because it's very different compared to, it's not as simple as, okay, you're having a fever, I give you Panadol lah, then settle. But you have a different way, because like I said, everyone has their own history, have their own problem, have their own support system and so on. So in the end, the treatment itself will be different. So can it be cured or not? Short version, it depends on your condition, depends on your how well you cope with it, and depends on your cooperation, depend on the expertise of the professional who are treating you and so on. And I hope this answer the question. Because I know that the question is very specific. Does it can be cured or not? But we cannot give a very specific answer, because the condition itself is not a specific. It's a very general. Because in the end, mental illness is that has multiple kind. There are various kind out there. So it depends on what kind of condition you have. And at the same time, we need to have this kind of mentality, perceiving that mental health is as important as physical health. Just like how we see people with cancer, people with diabetes, people with high blood pressure. So how can we give a treatment, giving sympathy, feeling, oh, so sorry to hear that. So that kind of treatment, we need to give the same to the person who are dealing with mental health issues. People have anxiety, depression, and so on. We need to have the kind of same mentality of supporting them and perceiving that in the end, mental health is as important as physical health. Okay, thank you for the question, Sabrina. Oh, Nuri.
All right, thank you, Mr. Aiman. Now that we've heard Mr. Aiman's views, Prof. Firdaus, do you have any additions with what Mr. Aiman has shared regarding the matter?
Okay, let me recap the questions. Any cure for mental illness, and what is the best way to improve our well-being? Yeah, when someone is cured from an illness, it means it's gone forever. Some illness cannot be cured, like diabetes. So one person can get diabetes, they will have it for the rest of their life. But even a lifelong illness like diabetes can be treated. People who take medications regularly and make some lifestyle changes can live lifelong and healthy lives. These medication and lifestyle changes are treatment for diabetes. So mental illness are the same way. There is no cure for mental illness, unfortunately, but there are lots of effective treatment to minimize the symptoms, to manage the symptoms, and allow the individual to function at work, school, or social environments. So people with mental illness also can recover, can get married, can work, and be happy if they want. So to answer the second question, what is the best way to improve our well-being? Treatment for mental illness include lifestyle changes, support groups, medication, and psychotherapy or psychological intervention. So everyone is different, yeah, as what Brother Aiman said just now. So you probably need to find a combination that work best for you. Some of these things, like medication and psychotherapy, that require working with professionals. But there are lots of things that we can do on our own. Okay, maybe Sabrina can share my second slide, please.
All right.
I name it things that we can do on our own is just GP. Yeah. The slide's not there yet. Yeah.
Yes, our ATK, yeah, okay, it's there. All right.
Slideshow, okay. Slideshow, the first one. You click all already, but it's okay. All right. Just DP, yeah. All right. First is connect with people. See, connect, yeah. So good relationships are important for mental well-being. So do not rely on technology, on social media, to build a relationship. Whenever you feel uneasy, try not to be alone. Go in touch with somebody who love you, who you love, yeah, who can make you laugh, who you respect. Yeah, it can be old friends, it can be new friends, for instance. Second is active. Yeah, be physically active. Being active is not only great for your physical health and fitness, yeah, but also for your mental well-being. Do not feel that you have to spend hours in gym, but it's best to find activities that you enjoy and make them a part of your life. Yeah, if you want to join Zumba, just jumping jack, play dumbbell or any type of fun movement, including whatever that's also related at home. Yeah, you help mom do mopping, clean the washroom, yeah, and whatnot. The third one is as skills, yeah, learn new skills. Learning new skills can improve your mental well-being by boosting self-confidence and raising your self-esteem. Even if you feel like you don't have enough time, yeah, you may not need to learn new things, yeah, but there are lots of actually different ways to bring learning into your life. So like this is a virtual learning world nowadays during this pandemic. You can learn new language, you can learn how to bake, you can attend any virtual courses that give extra to your CV or maybe give extra to your pocket money. Yeah, so why not? Number four is G. G is give to others. Research suggests that act of giving or kindness can help improve your mental well-being by creating positive feeling and sense of self-worth. Yeah, what is it that you can do? Maybe you can donate blood, you can smile to your neighbor, yeah, offer help to your lecturer, offer help to your mom, yeah, pay bills for your parents, yeah, and whatnot. And the last one is P, present. Be at present. Live at present. Paying more attention to the present moment can improve your mental well-being. So this includes your thoughts and feelings, your body, and the world around you. So some people call this awareness mindfulness. Yeah, mindfulness can help you enjoy life more and understand yourself better. So it can positively change the way you feel about life and how you approach any challenges in your life. Thank you.
Okay, thank you, Prof. Firdaus. And Mr. Aiman, thank you for sharing with us that mental illness is not a one-size-fits-all matter, and ways how to cope and curb our ways to cope with our worsening mental health well-being. Uh, so moving on, most people who deal with any form of mental health problems are afraid of the stigma from the people around them. You're mentally weak or you should be more religious. Statements like that make it difficult for people to feel comfortable in expressing their problems. Mr. Aiman, for the people out there who are experiencing these situations, what would you advise to them?
Okay, thank you, Sabrina slash Nurin, for the question. Okay,
Mm-hmm.
when it related to stigma, how do we deal with a stigma? We have to understand the stigma itself. Stigma basically is all about stigma. Basically, yeah, we can define as a label, a negative label that give by a certain population, giving to a certain population, which become harmful for them. For example, we as a human, sometimes we can be a bit ego, where we think that we have to know everything. We need to be this kind of mentality that we know everything, and when there's a time that we are exposed to a certain topic or a certain issue that is not under our expertise or even our understanding, we don't want to say that we don't know. Instead, we will create our own perception, as if we already know what's this issue all about. A simple situation, for a person, let's say there's a guy who never experience depression, never experience anxiety or any kind of mental disorder. And one day, he just know that one of his friend has been diagnosed with major depressive disorder. So when he heard that his friend has a depression, although that he has no background in psychology, no background in psychiatry, have no exposure or interaction with any mental illness patient before, so instead of asking, oh, depression, what's that? Some people will create their own perception. Oh, depression ni it is related to I know I once saw this in this movie, or I know that I once read in this Facebook comment saying that blah 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 blah, or you happening because you become depressed because you yourself are mentally weak, or you become like this because you are far away from the religion. So they create own perception, and this kind of perception is a wrong perception, is what we call stigma. Stigma is a wrong negative label that has been given to a certain population which become harmful for them. Basically, the way to break stigma, because the cause itself, because people don't know, become the stigma, and the stigma itself will make the mental illness patient to be struggle with the stigma, and they will be afraid of getting help. And when they're afraid of getting help, their condition will become worsen. And when the condition become worsen, the stigma increase. And with stigma increase, they're afraid of getting help. And they're afraid of getting help, stigma increase. So the condition we keep on cycling on there, sampailah Abang Jamil as long as no one gonna break the cycle always be there. And the ways to break the cycle stigma itself is by education, awareness, knowledge. You attending here, we together doing this program is one of the way to break the stigma. Because when knowledge came, stigma will be gone. Oh, depression happens because of this. Oh, I thought because far from God. Oh, I thought anxiety because the person itself cannot be positive. Oh, now I know. So stigma can be break by knowledge. So a person or any kind of any people out there who are struggling with the stigma around them, first of all, we need to understand by when it comes to mental health issue, you have to focus on yourself. The emphasization focus with everyone is important with other person, but in the end, self-care or taking care of yourself is the most important thing. When you want to seek help, regardless of people around you say that, relax lah, you still young, why depressed? People young, no depressed, you have no problem to think about. But they don't know the high risk people who are with mental disorder or mental health issue, depression, anxiety by WHO is the person with 19 to 25 years old. The young generation are the high risk of getting depression and anxiety. So how to deal with this kind of stigma is, first of all, understand which one is under your control and which one is out of your control. What people say, what people gonna think about, what people gonna say, oh, you happen like this, what people label you, this is all out of our control. It's just a circle of concern where you know they think that way, but you cannot do anything. Because in the end, that's only something that people have and you cannot control it. Yes, I know that you can teach them, you can educate, ask them to come to this program, listen to Dr. Mukhtar talking about this disease. Oh, okay. That's under our control. Your effort, how you're going to deal with it, that is under your control. But in the end, I always think that stigma about mental health issue or the education behind it, the psycho education, I always see it as like we as a Muslim, for example, you are Muslim, it's like dakwah. I always imagine that way. Dakwah, you can learn the technique, you can learn the content, you can present your message and all that in a good way, depending on the person and the situation that you are in the way of spreading the dakwah. But in the end, the one who will change the heart, either they're gonna receive the dakwah or not, is Allah. So in my opinion, just do your best, whatever you can, under your control, in your power, to help educate them related to this issue. If they still cannot accept it, then you need to let go the illusion of control. Because we cannot control everything in our life. You cannot control what people think. You cannot control what people gonna say. But you can control how do you deal with it. In the words of Albert Ellis, the founder of Albert Ellis, dia start dengan CBT ke RBT dulu, saya pun dah confused dah, lupa dah. Tapi basically psychotherapy, the situation, most of the time the thing that kill us make us feel stressed and make us feeling so tertekan, no? It's not the situation itself, but how do you see and how do you respond to the situation. We cannot control what's going to happen to us, but we can control how we're going to solve and how we're going to see the problem. If you still cannot change the mentality of the stigma, then that's one way, which is you don't need to tell anyone related to someone that you know they're going to have the stigma. Just tell about your problem to the one that you can trust. Maybe your psychiatrist or your best friend or your husband and wife and so on. However, if they still have the stigma, then we use something what we call I got this trick for my friend who are dealing with mental health issue. He told me that sometime when he expressed himself having a major depressive disorder, and people are gonna have the stigma because he keep telling that I feel sad, I feel tired, I cannot move on, I feel so stressed. He give like a symptom related to mental and emotion. So one of the trick you can deal with a person who are dealing with a stigma, who have the stigma about mental health is you don't talk about the emotional or mental symptom. You talk about your physical symptom. For example, let's say people with anxiety have a heart palpitation or your heart beating faster than normal and you have a chest pain and you have migraine and so on. So focus on that. Oh, Dad, I think I have chest pain. Or mommy, I think I have difficulty in breathing. So when people don't have a stigma related to physical condition, they can give you like, oh, what happened? You okay? Okay, gonna go hospital. Okay, let's go check the hospital. But when we express the emotional symptoms such as, oh, I feel so sad, I feel depressed, and people have this stigma, depressed, just be positive lah, it's just in your mind, relax. So use that against them. Focus on your physical condition, tell them, you're not lying actually, you're just focusing on the things that they can understand, and because of that, especially for our parents, because of that, they can bring you to the hospital and they can accept that you need a treatment. So whatever happened in the room with the doctor, with a psychologist or psychiatrist, that's going to be the after result. But the focus here is for you to seek professional help, and you're going to use whatever you can in whatever way that you can think of to get the treatment. So that's the focus. So conclusion, just focus that stigma is something that can be educated, but you have to understand in the end, second point is sometimes things they will be out of your control. So just focus on the thing that is within your control, which is how do you deal, how are you going to respond, how are you going to behave with that, and so on. And last but not least, focus on the physical condition if you are struggling with the stigma. Just talk about your physical symptom to the normal people. But with the doctors, you tell everything lah. This is for the average people. Okay?
All right, thank you, Mr. Aiman, for telling us how does this stigma come about. My apologies. Okay, so moving on. Thank you, Mr. Aiman, for telling us how does this stigma come about. How do we deal with this? Moving on. For Prof. Firdaus, Mr. Aiman has already highlighted that education is a factor on how we can change this stigma. Is there anything else that we can do to change this stigma other than education? Prof, I'm sorry, you're muted. Okay, now you're okay.
Okay, all right. Share my third slide, please. Thank you. Next. Next. Okay, yeah, this one. Right. Okay, back to the question. What else that we can do for stigma? A lack of understanding on mental health problem can discourage people from getting treatment. So when people are not sure between mental health, mental disorder can cause people to misjudge, dismiss, or even stigmatize those who have mental illness. So most important, do not simply call people gila, crazy, waya putus, and just because he or she visited a psychiatrist, seeing psychologist, or even take psychiatry medication. So mental health literacy could have a negative impact on the ability of those in need to get help and make informed decisions about managing their conditions. So mental health disorder or having mental illness is that none of them define the entire person. Although their symptoms might impair their ability to do certain things, they still have areas of strength and competence. Whenever we talk about health versus illness, it is always important to remember this. Therefore, poor mental health literacy contributes to the problem of mental health stigma. Those who do not understand mental health or mental illness often hold negative and harmful attitudes toward those with psychiatric issues. So these attitudes lead to shame, anger, and feelings of worthlessness. In many cases, social stigma can prevent individuals from seeking professional help. But above all, self-stigma can affect individuals, yeah, all of us here who have mental health issues but do not fully understand the concept of mental health and mental illness. So they may blame themselves for their condition, yeah, and self-stigma usually can make condition worse. We don't actually promoting to be positive all the time. Yeah, it is perfectly okay to feel sad, to feel angry, to be annoyed, frustrated, scared, and anxious. Having feelings doesn't make you a negative person. Yeah, it makes us human. So healing takes time, and asking help from others is a courageous step to do for a person who is sick. Yeah. So give yourself a break. Stop beating yourself up. Yeah. Everyone make mistake, has setbacks and failures. So we fail sometimes. Yeah. Not because we plan to fail. Yeah. But simply because we are human. So failure is a part of creating a great life. Thank you.
Thank you for thank you for sharing, Prof. Firdaus. So going on to the next part of our forum session. Unfortunately, it seems that we are approaching the end of our forum. We have one last question for Mr. Aiman. Where does one seek professional help if they are worried about their mental health or if they are worried about a friend or relative? And how does one know that your loved one or relative or friend needs mental health?
Okay, thank you Sabrina / Nurin for the question. How do you seek professional help? Uh, Before this, the era before COVID-19, you can seek professional help in terms of your mental health issues by simply walking into the klinik kesihatan, get an assessment, get a screening test with the doctor, and if there's a need to, they will refer you to the psychiatric unit in the hospital in the later date. So that used to be the case before COVID-19. But because of this total lockdown, PKP, but PKP olok-olok kan, not the real PKP. So what happened is they need to minimize the amount of people in the klinik kesihatan. So there's a new application come to the surface, which what we call as QMed Asia. You just Google je how to make appointment klinik kesihatan, and one of the link will be QMed. And through QMed, you need to do a appointment to go to the klinik kesihatan because they need to minimize the amount of people in the klinik kesihatan. So when you go to the klinik kesihatan, just tell them that you have related to your symptom, either emotional issue, you're feeling stress and so on, and the process will be the same after that. So that is if you are going through the public hospital through a route or path. If you want to go through any private psychology clinic, you can just simply straight away call them or give a WhatsApp video, WhatsApp chat and everything to do like a simple appointment, then come to the session and the process will be they will be continued by the psychologists who are in the session after that. Okay, so this is the technical stuff, how to get professional help. And I believe that most of you who are watching here is mostly a student. And when you are a student, you have this kind of privilege where university by MQA, they have a requirement that you need to have a counselor for every, I forgot the ratio. If I'm not mistaken, by the QA rules, you need to have for every 500 student, one counselor, or 800. I forgot the exact numbers. But most importantly, you need to have a counseling unit in the university. So use that to your advantage, because if you go to the private clinic, you have to pay a lot of money. For example, sometimes meeting counselor can cost you around 150 to 250 per hour. If for clinical psychologists, sometimes can go for 200 until 300. I think Dr. Firdaus like, okay, maybe 500 punya level lah. Tapi Dr. Firdaus is under UPM, so it's not private psychology clinic. So my point is, it's gonna be costly. You as a student, use the privilege that has been given to you by contacting your counseling unit. However, you have to consider the issue of total lockdown, where you have this like limitation to go to the clinic, you cannot go to the university and so on. So you need to contact your university, ask them what is the symptom or what are the current condition that you are doing in the university. How does counseling unit works during this pandemic? For example, we in IIUM, we provide like a psychology service unit also through online, where you can contact us through the link and you can just you can not Google, you contact us through the link and they will like give a simple appointment. Then through the appointment, they will refer you to the appropriate psychologist or clinical psychologist trainee, depending, to get the treatment for you. So whatever the situation is, that is for UIA. So in UPM, I'm not sure how's your psychology service unit working during this pandemic. Maybe Dr. Firdaus can add more about this, but I'm giving you the general idea. So this is the technical way to get the professional treatment for your mental health condition. But the question sometimes can be asked, how do you know that you need professional help? How do I know that, okay, I need to go to psychology clinic? So what you can do is, first, you can try to self-reflect, look at inside yourself. Is there anything you are struggling with, emotionally speaking? Is there any moment when you start to feel a severe emotion, for example, severe anger or severe sadness or severe anxiety? And how does it affect your daily life function? Does it affect your eating appetite? Maybe you become overeating or lack of eating appetite. Or does it start to affect your sleeping pattern? Maybe you oversleep or you doesn't sleep at all. Or does it affect your focus in the class, where you become overthinking ke, ataupun you cannot focus, you lack concentration and so on. So try to self-reflect to see how does it affect in your daily life function. And the third one is, you can do a simple screening test, and I believe you can get this online. Professor Ramli Musa have done a very good system about this, where you can just Google DAS-21 or Depression, Anxiety, Stress Scale 21, and one of the search result will be from the website from Professor Ramli Musa, and you can use the questionnaire to fill all the question, follow the instruction, and they give you like a simple overview about your depression, anxiety, and stress scale. But be aware, that is not a diagnosis. So if you have let's say the result will be depression, depression severe, anxiety moderately severe, it only shows that at the moment you are feeling depressed severely, but it does not giving you any kind of information that, okay, you are actually having a major depressive disorder, or your anxiety is high, or because you have a generalized or social anxiety disorder. So it's not a diagnosis. It's simply a screening test. Just imagine, okay, I close this with a simple analogy to make you simply to understand. Just imagine that whenever you're going outside and you want to go to the Tesco or your Speedmart or any shop out there, the first thing you need to do after scan the My Sejahtera is scan your temperature, right? So let's say one day you go to Tesco and your temperature is high. Having a high temperature doesn't mean that you have COVID-19. It only shows that you have a symptom who are having a fever, symptom of COVID-19, but doesn't mean that you have COVID-19. So it can be a lot of things. Maybe because you just walk in under the sun, under the scorching sun, and your your forehead become hot. So when scan temperature, okay, hotter than usual. Or maybe because you actually have a fever, or maybe because you're too hot. So whatever the case is, it doesn't show that you have COVID-19. How to know COVID-19? Because you have high temperature, you have a fever, then you go to the hospital, do a swab test, then you get the result, or you actually positive with COVID-19, or you are negative COVID-19. So the same concept apply here. Doing a DAS21 is not a diagnosis, it's a screening test. If you have a high condition or high level of depression, anxiety, or stress, then go seek treatment to get further assessment regarding your mental health. But if the score is low, but you still feel like, okay, no, I know that I'm feeling struggle by this, but okay, if you still believe that, maybe there's a lot of things, maybe can a bias when you answer the question, or you don't really understand what does it ask in the question. So you can still go to the clinic Satan as the procedure that I just told you just now, because in the end, you know yourself better, and there's no harm pun to go seek professional help, because yes, you're gonna like use your money and resources and time to go there, but you're not gonna lose anything in terms of suddenly gonna be something wasteful, because in the end you still learn something, you find out the status of your mental health. So you just apply the same concept if you want to see from the perspective of someone close to you. You can ask them, see is there any basic life function affected? Is there any struggle they are struggling with, emotionally speaking, and so on? Have a conversation, communicate with them. Whatever it is, just remember that mental health itself, we need to have a same perception that it is as important as physical health. Because in the end, mental health is related to your brain, and your brain is part of our physical body. So it's not one different entity or physical or mental, but it's one under entity, which is health. Okay, and that's all for me. Thank you.
All right, thank you, Mr. Aiman, for answering our last question in the forum. With that, I'd like to thank both of our panelists, Prof. Firdaus and Mr. Aiman, for the interesting exchange of opinions throughout the entire forum. Moving on to the Q&A session, members of the audience, you can send in your questions in the chat box. Don't forget to specify which panelist you'd like to answer your question. The first question is from, sorry, it's going to take a bit of time. All right, so we have our first question right here. Sorry, it's not. What is the acceptance level of people who are seeking treatment for mental health issues? So is that correct? Can't see that well. Okay. What is the acceptance level of people who are seeking treatment under mental illness? Prof. Firdaus, would you like to answer this question?
For the past 5 years, I would say, yeah, because of the lots of program, has been done by the professionals, and also the influencers and celebrities, and to the extent to the royal side, yeah. So the acceptance level of people who are seeking treatment to psychiatrists or psychologists has been increased, and then I would say that as high as 90%, most of our patients are actually able to understand and accept the given treatment, either medications or psychological intervention. So first, I believe the understanding of the psychoeducation given by the psychiatrist or the psychologist, for them to understand the issues that they are having. Okay, so that is actually lead to their acceptance of the treatment that they are receiving. Yeah, so I believe it has been increased day by day, and then with the service that currently been improve from hospital to hospitals, yeah, so that is actually helping more people to actually to seek for treatment. And in terms of family support, yeah, peer support also have been improved compared to the last 30 years, I would say. Yeah.
Thank you, Prof. Hopefully, Prof's answer will encourage other people out there to seek treatment for their mental health. All right. Moving on to the next question. All right. So this is actually a really well asked question. A lot of people are asking this. Hello, Prof and Mr. Aiman. I'm Nur Afika from UITM Alugaja. I'd like to ask if our family doesn't acknowledge our mental health, what are the best ways that we should make them understand? Mr. Aiman?
I want to
Oh,
emphasize. Yeah.
Should I go first? Okay.
okay.
Okay, thank you Afika for the question. Very good question actually. Um, I believe that I covered a bit about this from the previous question when I talked about how to deal with the stigma of mental health. How do you deal, especially when people around you doesn't understand as much as you do, and how do you make them understand from the perspective, doing your best and understanding which one is under your control and out of your control. I also focusing about we also discuss about how important it is for us to use the physical symptom as the indicator for them to understand. However, I believe that especially for people who are diagnosed with a certain disorder, sometimes support system from the family is very important. And family, sometimes not all family gonna understand how do you deal, how do you what is this disorder and so on. I've seen this in real life when some of my friend uh, this different friend have very good supportive system from the family. They understand really well what she's going through. They know that when's the time to get the treatment, how to get the medication, what medication to eat during a specific moment, how to do when the person is having a panic attack. So the whole family learn about that. So that's a very good support system. However, we also understand and need to acknowledge that sometimes there are families who are not really understand and they doesn't really know what is going on and they still have this stigma. So how do you deal with this is, first of all, the mentality will always need to be the first one. Mentality of understanding that the mental health is important as physical health. You need to have this mentality first, because as long as we don't have the mentality thinking that mental health is important as physical health, the stigma will always be there. It will always be there. For example, okay, I feel not okay. Should I seek? I feel too sad and I don't have energy to eat and so on. So should I seek professional help? So if you look at this from perspective of physical illness, like the photo that Dr. Firdaus just showed us just now, when it comes to physical illness, everybody can send flowers, send fruits, like a card, get well soon, and so on. Sometimes before COVID, they go to hospital, take picture together, post Instagram, GWS hashtag, and get well soon. But when it comes to mental illness, suddenly everyone as if it is something shameful to have that. But mental illness or mental disorder itself is the same like physical illness. It's a condition that no one asked to have. It's a condition that happen to anyone if you fit the situation and so on. So how do you deal with this is you need to change them to have this mentality and understand that asking or pursuing our family to have this kind of mentality, it doesn't happen overnight. It's not a process that when you do this, okay, suddenly tomorrow they're gonna wake up, oh, today I understand about mental health, I'm gonna support you. It's a process. It's not a turning point like that, but it's a process. It's a process where it's gonna happen like, okay, let's say 100% they stigma and they don't really want to understand or want to accept this kind of condition. So let's say slowly they start to accept the stigma getting reduced, and at the same time the awareness or understanding become more and more to the point that one day everything stigma zero and support system 100%. So this is what we're going through. So the process gonna take long. It depends on your family, depends on your situation, depends on how you're gonna explain to them, depends on how they're gonna learn about this. So everyone have their own timeline. Some people have like 1 year to pursue their family to understand. Some people already 5 years but still doesn't understand about their condition. So whatever it is, just do your best and just understand that you also need to focus back on the concept of control system. So you did your best, and if they still doesn't understand and you start to feel stressed about it, then you need to know your limitation as well. Your limitation is someone telling themselves, but in the end, you need to let go the illusion of control lah. Maybe you can ask someone that they respect. For example, the issue of vaccine and issue vaccine nowadays. Some of the parents doesn't really want to vaccine. They don't want to accept that vaccination is one of the way to fight this pandemic. They don't want to hear from you. But like when some ustad tell them or some person that they respect to talk about it in their kuliah and they listen to the kuliah and the WhatsApp, oh, okay, vaccine, okay. Then suddenly your family, okay, boleh vaccine. And I've seen this in real life. My family's, my friend's father, who are very tolak terus vaksin. But when one day he just there's a, if you remember the poster when the Mufti Meng have a vaccine and they show like ulama-ulama in Imam Makkah, Sudais semua dah dapat vaksin, and when the father saw oh, even Imam Sudais, Imam Masjidil Haram pun vaksin, oh, this is okay lah. Then he go through vaccine. So sometimes the education or the knowledge or the perception thinking process doesn't necessarily come for you. It comes from someone else. So it's this like concept of dakwah lah. Sometimes the effort from us, but the dakwah itself from Allah, and Allah can send anyone He want through anyone to the right person at the right moment. Okay.
Thank you, Mr. Aiman. I hope this answers your question, Afika. All right, so another question, please. All right, so from Adlina Jamaluddin, Prof and Sir. So, of course, Prof, you'll be answering this question. My question is, does eating food or medication that increase happy hormone will help with stress or depression?
Sorry, let me try to understand the question. Eating food or medication increase happy hormone will help with stress, depression. Okay. In terms of food, okay, so there are certain food that actually reported could actually stimulate the serotonin hormone, yes, the hormones that could help to increase oxygen level in the blood vessels in the brain. So that could actually help to control, to reduce the cortisol, the hormone that make a person stressed or depression or depressed. Yeah. So there are influence of certain food to stimulate this hormone in order to alleviate the stress and depression. Same goes to medication. Yeah, certain antidepressant, okay, that prescribed by the psychiatrist, which is something that you cannot actually buy over the counter or the pharmacy. Okay, in which that is could actually help to create certain neurotransmitters in brain to elevate, to reduce the symptoms of depression and stress. So what happened is in our brain, okay, so there is like a hippocampus. Okay, so that hippocampus is actually once a person take a medication, so or certain food also, but it's not enough in the case of having mental illness. Yeah, so food, I understand that people for this question, yeah, so it's not enough if for being somebody who being diagnosed as mental illness just to take certain food to reduce depression. Okay, so I just explained about what is the influence or effect of having this kind of food and medication. So what happened to the brain is it will expand a bit in terms of stimulate the oxygen level in the blood vessels, and then that stimulate the certain neurotransmitters, and that from the hippocampus, so that could actually control that neurotransmitters that influence the amygdala. So the amygdala in our brain is actually the one that control our emotion. Okay, so that will best explained by the psychiatrist who prescribe the medication. Okay, so the level of dosage, it's all actually reflect your intensity and the severity of the symptoms that you're having. To simply say that certain food actually lead to reduced depression, that is not that correct. Yeah. Okay.
All right. Thank you, Prof, for your answer. So let's move on to our next question. All right, by Akila Izati. So, Prof, I would like you to answer this question. Hi, I want to ask how to deal with sudden wave of emptiness where I often feel like I'm alone and I don't deserve to live. And this person is also diagnosed with anxiety and panic attack disorder.
Okay, thank you, Akila Izati. Once you've been diagnosed with anxiety, with panic attack, I believe the best answer could actually get from your treating psychiatrist or psychologist. But what I would say, in general, for everyone to understand this question, okay, so whenever that you have anxiety, okay, some of the symptoms that you can feel is losing touch of a reality. Yeah, so sometimes the feeling gets so intense that to the extent that you don't feel anything. Right, so that's maybe that describe the emptiness. So that is something that you got to understand. Okay, first in terms of the psychoeducation, why that happened. Okay, so usually when you get panic, okay, so something that triggered in your mind, it will influence your breathing, your respiratory system. Okay, so when you get shallow breathing, okay, so or you can become you get hyperventilation. Okay, so it is like fight and fight system in your brain. Okay, so that's will lead to the emptiness or the feeling of you don't feel you feel that so panicky, okay, to the extent that you don't feel anything. All right, okay, so that psychoeducation on understanding why this happened is the first thing that you got to know. Second, how to deal with it. Okay, so besides medication, there are several types of strategies, especially the one that been reported in the literature is a cognitive behavior therapy. Yeah, so this therapy could actually giving you some choices of the strategies on dealing with emptiness. Yeah, it can be in cognitive strategies. Yeah, some skills that you can understand through identify the thoughts that related to emptiness and then modify your thoughts related to emptiness first. Second is in terms of the behavioral. Yeah, behavioral. What is it that you can do physically? Okay, maybe related to grounding, maybe related to behavioral activation techniques. Yeah, so some activities under cognitive and behavioral activities, and yeah, could be also some strategies in mindfulness. Yeah, can actually help to deal with the sudden wave of emptiness. Hope that helped.
Thank you, Prof. Firdaus. And let's move on to our next question. All right. Assalamualaikum and hi, by Iswafiq. He has a question, whereas how are you supposed to forgive yourself? How should we forgive ourselves and accept our past mistakes when the people around you keep bringing it up? So, Mr. Aiman, if you may.
Okay, thank you, Bais Wafiq. Good question. Waalaikumsalam. Okay, how do you forgive yourself and accept your past mistake, but people around you keep bringing it up? I believe this question is very counseling related or counseling perspective when you are dealing with any intra or intrapersonal issue, such as maybe a mistake that you happened in the past or anything that needs you to be acceptance and forgiving yourself. Okay, regarding this situation, when you are dealing a situation when you have a past mistake and you need to forgive about it, the process is a long process, and it's a process. Doesn't happen overnight. Meaning that the first thing that we have to do is when you focusing yourself, not focusing, forgiving yourself for the past mistake. Okay, the point that I want to emphasize here is, if you already able to forgive yourself and you already able to accept your past mistake, and when people around you bring it up, okay, the situation is you already forgive and you already accept, and when people around you bring it up, it will not affect you because you already solved the problem. You already solved the unresolved issue inside yourself. So when people talk about it, you don't feel anything. You don't feel any kind of trigger, or you don't feel stressed, you don't feel down, or you don't feel like, oh, janganlah cakap macam tu. Because when you already forgiving yourself, you're gonna be affected by that. So my point here is, if you still be affected by people around you when they bring it up about something in the past, means that you still haven't solved the unresolved issues inside you. So one way to do this, of course, you need to go for counseling, because you need to explore your past, try to see the situation from another perspective, and so on. All the counseling technique in the session. At the same time, forgiving yourself and accepting yourself, you can do a simple, not simple lah, you can do some practical question that you can ask yourself that gonna make you feel okay with it. First of all, I would suggest you, whenever you're feeling not well, or you're feeling emotionally distressed because of the situation, the first question you ask yourself is, okay, explain what is the situation. You talk to yourself, by yourself, verbalize it, tell yourself, okay, what is the situation? Or the situation is, my friend talk me about my past mistake and blah 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 semua kan. They talk about, okay, let's say that the situation is you fail in your exam and you miss the opportunity to go to your preferred university or your ideal university, and your university yang impian nak pergi tu. So you say, okay, my friend talk to me and ask me about my past mistake, and I feel stressed about it, and tell yourself what is the situation as if you are telling someone who doesn't know about you. And the second question is, okay, try to identify what is the emotion that you are feeling because of that situation. Try to be aware of your emotion. Or, I feel stressed, I feel sad, also feel angry because he asked me that. At the same time, I feel regret because I didn't study much. Okay, so that's the emotion. The second question is, try to tell yourself, try to identify based on the emotion, try to measure the scale from 1 until 10. Let's say the emotion is sad, so 1 is like, okay lah, sad lah. But 10 over 10 is like, oh, I'm really sad, really sad. So try to measure your emotion where you are right now. Then list out, okay, my stress maybe 7 over 10. My sadness quite high, 9 over 10. Regret maybe 2 until 10. So it helps you to identify your emotion, to you be aware and to be mindful about your own thoughts. And when you do that, try to close it with the technique that Amir Khan has taught us in the movie Three Idiots. If you still remember, what he did is put your hand on your chest and he said, all is well, all is well. I know it sounds funny, but actually it's a very good self-talk technique. When you are soothing yourself, you're telling yourself, then you soothe yourself as if you hope someone to say to you, as if you know someone who are struggling with the same situation like you, and you want to comfort them. Then talk using the same dialogue to yourself. It's okay, Aiman. What they say, your past mistake, I know that you're feeling regret because of your past mistake, and you need time to be to forgive yourself. If still okay, that's okay. You need time to process all of this, okay? If you still feel angry about it, that's okay. Identify that you're feeling angry, and slowly we accept yourself, okay? You still haven't, okay, that's okay. Take your time, okay? This is a process. Talk to yourself and comfort yourself as if you are comforting someone else who are struggling with your issue. So what the technique I just talked to you about is a process. It's not a 1 point turning point. It's not something that, okay, habis je apply ni, then suddenly you okay. It's a process. Maybe your regret tu macam ni, then slowly your regret becomes slowly. Okay, maybe it takes time, and so on. This is why one of the thing that I don't agree with the quote people always said, time heals. I don't really agree with that because time and treatment heals. If you just focusing on time, then logically people who are having traumatic event or maybe have depression should be okay lah now after 10 years. But some of them still struggling because maybe the condition, maybe the treatment and so on. So time and treatment heals. Both of them need to come together.
All right, thank you, Mr. Aiman, for that detailed explanation on Bai's question. So we have another question from Afika. So is there a possibility of someone who has stopped oral medications to relapse without the supervision of their psychiatrist? Prof, if you may.
Yes, very high possibility. Okay, for someone who stop oral medication, okay, antidepressant, anti-anxiety, yeah, without supervision of of the psychiatrist. Yeah. So first of all, whoever that you heard taking medication, especially antidepressant, anti-anxiety, or antipsychotic depression, it shouldn't be treated as it shouldn't be take it as paracetamol or Panadol, yeah. When you want to when you have headache, then you take it. When you have fever, you take it, and if not, then you are okay. It's not like that, okay. So psychiatric medication first must be supervised by the psychiatrist. Second, it can't be sudden stop. Okay, it need to be tapered from time to time. Okay, under supervision. Okay, I understand due to financial reasons. Okay, this could actually give reason why you've got to stop the medication or somebody that you know stop medication. But it's always good to discuss with the psychiatrist because certain hospital do actually provide some help, financial assistance for this to purchase this medication, right? And number four, the tendency for a person to get relapse, yeah, sometimes is actually even worse condition compared to the first time that they actually have the symptoms. Okay, so that is a thing that we are really concerned. Okay, not stopping the medication without the supervision. Right, because of that relapse is actually even worse compared to the first time that you're having the symptoms. Yeah.
All right, thank you, Prof. So moving on to our next question, we have a question from Anish Shuhada. May I ask, how does ADHD differ from procrastination, and is it a common issue in Malaysia? So I guess this is more to Prof's lane, Mr. Aiman. Yeah, so we'll give the question on to Prof.
Okay, right. Obviously, ADHD is actually differ from procrastination, right? ADHD is a mental disorder, is a diagnosis, and procrastination is one of the symptoms. Yeah, it could be depression, it could be psychosis. Yeah, so it's not a diagnosis or it's not an illness itself, right? So ADHD, there are three things that is very important when someone is being diagnosed of ADHD. First is impairment in terms of attention. Yeah, you cannot focus. You cannot give attention. Second is hyperactivity, right? So you cannot take turn. All right. So someone could actually can concentrate on doing certain tasks. Yeah, very hyperactive. Yeah, and the third one is impulsivity. Impulsive means you cannot actually control yourself to relax, okay, before you do things, right? So you want to ask something immediately, you want to do something, you know, before given you are allowed to actually to give a chance to say or to do something. Yeah, impulsivity. So and it must important to know that in order to be diagnosed ADHD, it must be observed or noticed at more than two settings. Yeah, so say you feel like I have ADHD. Yeah, so your parents or family also support that situation, and also maybe your school or school setting also, university setting also, see that you have these symptoms. Yeah, and then the clinician also see that this supported not just from your from the clinical observation, supported from the parents and also school setting, and if possible, okay, there is assessment for ADHD that support the diagnosis. Yeah, so it is not simple. This because I can focus, just because I can tak boleh duduk diam, somebody called ADHD. Yeah, and what is that differ to procrastination? Procrastination is you delay certain tasks, certain work. Yeah, so it is actually related to emotion, right? So procrastination, even though it's a behavioral, so you delay things, you postpone things, you plan very well, but eventually that you don't do things, is actually need to see at emotional level. Okay, so it could actually influence from depression, it could actually underlying anxiety, it could actually some of the symptoms of psychotic, so it is or substance, so it is not straightforward. Procrastination is that person memang malas, memang suka tangguh kerja, so it is not something straightforward like that. You need to be understand the whole perspective of why a person procrastinate, and that is very common in Malaysia. Yeah.
Very common for students, especially, Prof. Okay. So we have our next question. Thank you for answering. So this person asks, what kind of advice can we give to our friends that are telling us their problems, and how to avoid toxic positivity in the advice that we give them? All right. So Mr. Aiman, please.
Okay, thank you.
Yeah.
Okay, thank you. Apa nama ni? Dash dash. Okay, what kind of advice that can we give to our friend that telling us their problem or stress, and how to avoid toxic positivity? Okay. Thank you for the question, dash dash. Not sure what to call you. Nama kat situ dash dash kan. Okay. When you have a friend who express their stress or express their problem towards you, sometimes we have this kind of thinking that we have to give them an advice. We start to see, okay, what is the best advice that I can give? What can I do? What can I say to them? What can I respond? But sometimes when people are telling their problem, sometimes it's just about them want to express themselves. They just want to vent out, and they need someone to listen, and they don't need our advice. This is not, of course, the overall all the case lah, but depends on the situation kan. But what I say is, try to focus on what you can listen rather than focusing that what you can say back. Of course, not gonna be like one way conversation, and it's like talking to a machine lah, talking to the wall. They talk about something, then you just not saying anything. Of course, you need to give like a non-verbal feedback. Sometimes, for example, you're nodding. Oh, serious ah. Oh, lepas tu apa jadi? Serious ah. You put some kind of encourages or some kind of feelers when you try to give an indicator that you are actually listening to their problem. You are listening to their story. When they have finished talking, you can also ask them back. For example, question like, okay, what happened next? Okay, ada lagi ni. Okay, then what happened? So what do you do after that? Oh, serious ah? Then what the girl do to you? You follow their story, you follow what they're talking about, just so that they have the opportunity to keep talking about their problem. Okay? Jadi that's one of the way that you can do. And the end of the session, when they're still talking about when they already finished talking about the problem, and you are looking a ways for you to respond to them, you can just simply use the same story from them, but use your own word. You just paraphrase or summarize back everything that they told you. For example, oh, I see that you're feeling stressed, or you already studied so much, then you fail your exam, and now you have to repeat your subject. So this situation must be really stressful for you. And the way you do this is to indicate to them that you are actually listening to their story. And the person who expressed their stress situation, they're gonna feel really, really happy, because when you talk back to them, you respond using their own story, they will acknowledge it. Oh, you're listening to me. Oh, you talk about this stress. Oh, you talk about my exam. Oh, you really listen what I talk about my exam. You really listen what I talk about my feeling. So sometimes that is the best response rather than you're giving advice or giving providing solution. However, if the case is they specifically ask for an advice or solution, that's another story. Because the tips I just give you is more like when you're just casually talking about the problem. But when they specifically ask, okay, what do you think I can do? Do you have any advice for me? So when they specifically ask about that, then you can give advice. So this is regarding to your second question, how to avoid toxic positivity in the advice that we give them. Toxic positivity is uh, can be defined as when you are becoming too positive, you're trying to be everything must be positive to the point that it's become toxic. For example, when people are feeling stressed and you don't acknowledge their struggle and you just focus on the positive. You don't need to think too much about this. This is just in your mind. Our life need to be happy. Others have it more struggle than you. This is kind of the advice that become toxic, although it sounds positive. So how to avoid that? The difference between genuine positivity and toxic positivity. Toxic positive bleh. Toxic positivity is simply focusing on the positive. But when you're talking about genuine positivity, you acknowledge the negative side, then you focus on the positive. There's a difference. For example, let's say Sabrina talked to me. We were talking. Let's say after we're talking, then Sabrina said, "Oh, I'm feeling stressed. I'm feeling tired after conducting this session, conducting this, become a moderator. I feel so tired." Then a toxic positivity advice will be, at least you get to meet with Dr. Firdaus and Aiman, or at least you get to present yourself to the person in front of you. You're simply focusing on the positive, which is true. There is a positive side about it. But it becomes toxic because we don't acknowledge their struggle. Because at that moment, what Sabrina want to hear is not about the positive side. Maybe yes, positive side is important, but not at the current moment. At the moment, she just want to be heard. Oh, I see, you're feeling stressed. Would you like to talk more about it? So you give them opportunity for them to express all the negative emotion or negative side of the feeling and so on. Then you focus on positive. You acknowledge the negative as well. Because I see this when it comes to negative or emotion issue, it's like you are driving a bus and you are a bus driver. Let's say when you are a bus driver, when what you do is you're gonna pick up a lot of different passengers. You have a positive passenger such as hardworking, motivated, excited, happy. At the same time, you're gonna pick up a passenger that is negative, sad, depressed, fatigue, lack of pleasure, doesn't really work well, cannot focus in the class. So I'm gonna pick up a lot of different passengers. And you as a bus driver, you still pick up everyone because you know that no matter they are positive or negative, for every passenger, they have their own destination. So although the passenger is negative, you still pick them up, go to the seat, because we believe that there will be a time, a certain destination, the passenger will get down and move on. So that's what we call as genuine positivity. You acknowledge that the person is feeling something, what we call as inconvenience for them, then you focus on positive after that. While toxic positivity only want to turn everything into positive without acknowledging the negative. Okay, I hope I answer your question. Dash dash.
Thank you, Mr. Aiman, for telling us how to respond to people who are telling their worries to us. I think it's a very important part of life and how we deal with people. So, unfortunately, our Q&A session is coming to an end. So, we have only one question left, and it's from Zulkifli Hasmi. Okay. Sometimes we feel gloomy and empty, but are afraid to set an appointment to the hospital because we are afraid if the diagnosis turns out to be not a mental health issue or turns into nothing, what should we do? Prof, could you enlighten us on this question?
Okay, thank you, Zulkifli, for the question. Okay, let's imagine this scenario. The situation is presentation. You got to do presentation in front of the class. Okay, right. First column is situation. Second is emotion. For someone, presentation makes them feel so anxious. All right. Somebody else could actually feel depressed because of depression, because of presentation. And someone else could actually feel angry, okay, because of presentation. Someone else could feel excited, yay, presentation, okay. And the other one could actually just blur presentation, tak tahu, okay, right. So those who are anxious, there is a possibility of checking to rule out if in case that person have anxiety disorders, generalized anxiety disorders, panic attack or panic disorders and whatnot. Okay, for the depressed person, we try to understand if in case there is the symptoms that meet depression symptoms. Okay, for the angry, okay, the one who angry with presentation, yeah, maybe ada issue with substance, maybe there is issues, relationship issues. You don't want to see your crush, your past, or your ex. Okay, right? The one who excited. Okay, maybe having symptoms like mania episodes. Yeah, bipolar disorder. Right? And those who are blur, maybe we need to check whether there is hallucination, delusion. Okay, related to having have the responsibility to present. Okay, but sometimes those who have feeling either positive or negative about the presentation, there is a chance that there is no diagnosis at all. There's no mental disorder to relate to this emotion. Okay, so what happened? Maybe that person who actually having struggle of emotion related to presentation could actually in conflict of the role. Okay, so I'm the one, I want to present virtually, but my mom asked me to take care of my younger baby, my younger brother. Okay, all right, and after this I have to do this, to do that, in conflicting of the role at that particular moment. Yeah, sometimes it gives a loss of emotion to deal with the task that you are actually used to. Okay, so that is actually reflect to the questions of Zulkifli. Okay, so it is okay. It's actually a good step that actually you go whenever or somebody else, okay, go to the hospital. If doctor said, yeah, nothing's wrong, it is normal, it is part of stress and it is affected everyone, including myself. Okay, and then just okay, smile and then do some healthy lifestyle. Okay, in order for you to feel a bit better and better to improve your quality of life. Okay, thank you, Zulkifli.
All right. Thank you, Prof, for that, for the answer, and thank you, Mr. Aiman, as well. Now, I want to thank you both of our panelists again. Thank you to both of our panelists for answering the Q&A questions and joining us here today. I learned a lot, and I'm sure our audience learned a lot today as well. Hopefully, everything that you've enlightened us with will help us with our future and in dealing with our mental health issues. Thank you so much. So I'll pass on the forum session to our MC, Ahmad Daniel.
Thank you, Nurin, for the fantastic sharing session with our great panelists just now. Now, it is my pleasure to invite our Fostech Association advisor, Dr. Noliana, to deliver her speech.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Daniel. Can you hear me?
Yes, Doctor, we can hear you.
All right. I'm not sure whether my line is okay or not, but anyway, I'll have a quick says here. So I would like to thank the committee of Fostech for their initiative in doing this kind of like event. And as I do concern, this is the second time of Healthy Minds Network program has been executed for this year. And special thanks to the Professor Dr. Hajah Firdaus Mukhtar and also Mr. Aiman Amri as your, giving the time and also your expertise in saying something today, okay, in giving your thoughts and also insights for today's event. So I believe that every one of you has gained something beneficial for today's session. And what I can say is that health issues is the most important situation nowadays, especially during pandemic. And sometimes it can be difficult to open up. So if let's say one of you or you know someone who is struggling with this kind of problems, try to seek help and also try to talk about your mental health, because this is not something easy for us to actually experience it, okay? And I do hope that for today's session, everyone has gained a lot of knowledge on how to deal with if you see that someone is struggling about these issues. And as a community, I do hope that we must do more help, okay, especially to our loved ones in supporting people or in supporting our surroundings throughout their dark days, okay. And then with the pandemic that is not going to, seems like it's not going to end at the moment. And also with the increasing societal rates, especially nowadays, I hope that we must come together and find a positive ways to involve ourselves in the conversation of the mental health. So it's not something strange or peculiar anymore, as we need help if we are experiencing these kind of things at the moment. Okay, so with that, I would like to once again thank Professor Dr. Hajah Firdaus and also Encik Mr. Aiman Amri for having the time today. And then also big congratulations to the Fostech team for initiating the Healthy Minds Network 2.0. All right, thank you so much.
We express our utmost gratitude to Dr. Liana for her speech. Before wrapping up our program today, the moderator, both panelists, Dr. Liana, and the director of this program are asked to open the camera and get ready for the photography session together. Okay, 1, 2, 3. Okay, another one, freestyle.
Boleh please? Oh, okay.
Boleh freestyle. 1, 2, 3. Okay. Okay, last. Okay.
Oh, ada je.
1, 2, 3. Okay, thank you.
Thank you everyone.
Thank you. Well, thank you for your great cooperation for the photography session just now. Ladies and gentlemen, with the end of the photography session just now, our event has finally come to an end. I, as the MC for today, would like to say 1,000 thanks to all the audience who have been involved today. Millions of thanks are extended to the panelists who attended our event today. Hope the information given by panelists can benefit all of us. Before leaving the event, ladies and gentlemen are asked to scan the QR code displayed on the screen to fill in the Google form as a proof of attendance. And for merit matters, please note that you need to screenshot this YouTube live as the evidence to fill in the Google form. On this occasion as well, I represent the members of Healthy Minds Network 2.0 committee and Fostech members would like to apologize if there were any unintentional errors throughout the event. Wabillahi taufiq wa hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Thank you everyone.